And it's not just Pinellas that's feeling the pressure. COVID patients have nearly tripled in the state in just a few weeks' time, and it's stressing out our hospital systems. So if you were to get sick, and let's say you needed a hospital bed, would you even be able to get one? 10 Investigates' Jennifer Titus is digging through bed capacity data in our Bay Area hospitals to explain what all of this means for you.
A quick check of the latest outlook of hospitalizations in the state of Florida shows more than 83% of beds are in use. Nearly 22% are in use for COVID-19 patients. Now, this is data hospitals report directly to the Department of Health and Human Services. In the past, the Agency for Healthcare Administration released their own data that had a county-by-county breakdown on capacity at hospitals. When hospitalizations started to go down a few months back, they stopped releasing their reports. So 10 Investigates dug into what is available now on the HHS site. You can look up capacity by hospital. We found 9 hospitals in the Bay Area have less than 5 ICU beds available. 2 hospitals have no ICU capacity at all: Moffitt Cancer Center and Advent Health Carrollwood.
When we take a look at ICU capacity, every single person should be looking at those numbers right now, even if we don't have COVID.
Right, it should be of interest to everybody, but because when health systems, when hospitals are overburdened, what we might think of as elective procedures, but elective procedures that are really important, start to get delayed. People's desire to go and get routine checkups or get something that they're concerned about, maybe chest pain, they don't go and get that checked out at the emergency department.
Dr. Jason Salemi with USF Public Health says the latest hospital numbers show us a much more transmissible Delta variant, sending people of all ages to the hospital.
When you see a 6-fold increase in hospitalizations in such a short time span, that is cause for concern, and that should be an awakening for all of us to start doing what we can to block transmission.
And Dr. Salemi says that looking at the numbers and talking to colleagues who forecast trends, we're unfortunately going to see numbers continue to get worse before they get better. But social distancing, masking up, getting vaccinated, that could play a part. 10 Investigates created our own data set for the number of occupied hospital beds in the Tampa Bay area. Let's take a deeper dive into some of those numbers, because according to HHS, there are 1,196 ICU beds in the Tampa Bay area. 955 of them are occupied, meaning 241 are open. 12 have 5 or fewer ICU beds available, talking about hospitals here, while 2 hospitals have 0 ICU beds open. We have a spreadsheet with specific hospitals that you can find in this story at 10tampabay.com.